Hello there, I'm Dr. Nazanin Moali, clinical psychologist and host of Sexology Podcast, and I'm here to help you to prepare yourself for the first therapy appointment. There are mistakes that people make when it comes to preparing for the first therapy session, and also I'm going to talk about logistic things that you need to prepare ahead of time before going into a session in order to make sure you are making the best return in your investment. As a psychologist, I have worked with hundreds of individuals in private practices, in clinics, in intensive outpatient programs. I have seen individuals that have prepared themselves for success, and I had people coming into therapy and not having a clear expectation and not seeing a return in their investment. So I'm here to share with you some of the wisdom I curated after helping so many people. I'm going to start with talking about the 3 mistakes people make. Number 1 is to not thinking about the importance of the match. Hopefully you found someone, they have great credentials, they came with recommendation, you feel good about it, but it's really important to assess if you have chemistry with that person or not. In therapy literature, over and over, what we see is when there is a therapeutic alliance, which is a fancy term for if you like your therapist or not, the result, the outcome is significantly different. It's not the same if you're going to your primary care doctor. You can get excellent result from a primary doctor that you don't like, right? They prescribe something, you take it, and then you'll see good results. But with therapy, you need to make sure that you are finding the chemistry. And so when you're going in for the first appointment, you want to really pay attention. How do I feel sitting in the room with a person? Do I feel judged? Do I feel uncomfortable? It's normal for us to feel uncomfortable when we're talking about the part of ourselves that perhaps we're not comfortable with. If we are in a therapy session talking about our porn habits and we haven't talked about our porn consumption with anyone, it's normal for us to be able to get uncomfortable. But my invitation for you is to think about if you're thinking about 100% is someone that's excellent, right? That's someone that you feel like you can talk about anything and everything. I would say if you feel it's less than 50%, right? It's 40 or 30%. It's really difficult to talk with a therapist. You're really not connecting. Then you don't want to continue with that person. If you are somewhere between 60 to 70%, like you feel you can have a conversation with them, you can see that there are some potential, but you're not sure if they're getting you or not, then you want to give it a second chance with a second appointment. But if after a couple of first appointment, you feel that you don't have the chemistry, it's really difficult to talk to the person, you feel not heard, not seen, then it's a good time to switch to another provider. Number 2 is not communicating your financial expectation, the amount of investment you're going to make in therapy, because sometimes people come in therapy thinking that all it takes for them to get result is going to the first appointment, or maybe they have limited resources and the resource they have is only sufficient for one appointment. In general therapy world, the way it works is the first appointment is when the therapists make evaluation and assess what are some of the things that you and the therapist going to continue working on, what are some of the things that need to be addressed. So it's more about assessment. It's very rare a therapist provide intervention during the first therapy session. Sometimes people come into my office and I ask them, have you been in therapy before? They say, yeah, I've been to a few therapists. And when I ask them, they say, I went to one session. Going to one session is like taking your car for an assessment inspection to a mechanic, right? They haven't started even working on it. They might have gave you an itinerary with the receipt with a list of the issue. It's the same with therapy. If you only go to one appointment, all you've done is going for an assessment. So it's really helpful if you communicate with a therapist saying that I have funds, I have resources for X number of sessions. And can you help me see some progress in this? Or can you direct me to resources using these number of sessions? For example, I had clients that they had extensive trauma history and they wanted to address the sexual health issue only with few sessions. And they didn't even start talking about their challenges until session 3 or 4, because it's really hard to trust your provider with something that you feel so much shame around. Understandably, it takes longer for you to see result if the issue is more complicated, is harder to talk about it. And when you share with a therapist that I only have resources for one session, and they can help you with setting an expectation. Sometimes people come to me with funds for one session. What we do during that one session is to help them identify the things they want to work on, and together we create a self-study plan for them that they can do on their own, which is very, very difficult. But I've seen people seeing results. The same way that, for example, if you want to change your body, you might go to a trainer, they can give you a plan, right? It's significantly more difficult if you're doing the plan on your own or you're doing it with a trainer. But if from the beginning, if you're clear about the expectation, that can help you to see better result. Number 3 is not knowing about ramification of using your insurance. For many people, they have the expectation that I'm going to use my insurance, whether I'm going to find someone that's in network or I'm going to find an out-of-network provider, but I'm going to submit my receipt and my diagnosis to get potential reimbursement. So one thing that's important to keep in mind, in order for you to be able to use your insurance, the provider, they need to give you a diagnosis, a mental health diagnosis that shows that your treatment is part of what we call medical necessity. So you really need therapy. That often comes with a diagnosis that are more stigmatized in a way, right? And that can stay in your medical record. Insurance company can audit the therapist notes so they can access the content of the session. And each session, the therapist need to show that you're still struggling enough that you need therapy. And you might say like, okay, so what? Like I struggle with this particular issue, maybe anxiety and depression, and how is that gonna impact my life long term? A few years ago, there was this case of an individual that was very unjustly poorly treated by an airline. They wanted to sue the airline, and the attorney subpoenaed their medical records from their therapist. The passenger, he was seeing their therapist for 10 years. And he didn't feel comfortable going to court knowing that their therapy record will be something that it can be used as part of the court proceeding, and it could be part of the public record. Just because of that, he chose not to pursue the legal action. I'm not saying that's the case for everyone, but knowing pros and cons can help you to make an educated decision. And you also have an option of going to someone that they're not using insurance, so they don't need to show that your treatment is part of medical necessity. Therefore, they can keep their notes very discreet. For example, when people come to me, my practice is not part of an insurance panel. My notes are very vague, right? Because I'm not trying to prove the person is sick enough that they can use their insurance. I keep the notes in a way that even if it gets subpoenaed, people will not see the sensitive information that was discussed in our session. All right, so let's talk about logistics. So you made an appointment, you probably got the intake paperwork, and you have a date for the appointment. It's really helpful to know that where is the office? How are you going to get there? If you're going for an in-person appointment, depending on where you are, traffic could be different. It's expected that often therapy session starts exactly an hour or 30 minutes past the hour. Maybe it's more acceptable if you're going to a medical appointment, 5 minutes, 10 minutes, or 15 minutes late. But for therapy offices, it's customary for a session to start right on time, because that's also part of a treatment. When you get the intake paperwork, my invitation for you is to set aside some time to answer the questions thoughtfully. So for example, if you're going for couples counseling, just don't say that I want to improve my marriage. Talk about in the intake paperwork in detail, what do you want to see more of? What do you want to see less of? Because your therapist, they will review the paperwork ahead of time and they prepare the first session based on your responses. So the more detail you put in your intake paperwork, the more successful session you will have with your therapist. Some therapists, they have a video counseling option. I also offer video counseling. When it comes to video counseling, it's really important to make sure your therapist chooses a platform that's confidential. Not all platforms are confidential. If they're FaceTiming you, that is not confidential. There are specific platforms that are HIPAA, what we call HIPAA compliant, that are designed for confidential information. And when you get the link, my invitation for you is to make sure that you're clicking on the link to see that if it's working for you or not. I would say maybe go on the link 15 minutes early to make sure the audio works, the video works, and you want to make sure you are somewhere that you have privacy. You don't want to drive. Most therapists, they're not going to do the session if you're driving because it's a liability and you're making an investment in your time. If you're driving, you're not fully focused on the session, so the session wouldn't be as powerful. Besides logistic, there are things it's important to do emotionally before the first session. First of all, know that it's completely normal for you to be nervous. Talking about our challenges often can make us feel nervous, embarrassed. Have some compassion for yourself and understand that is completely okay. And if you're anxious, my invitation is to have some kind of a distraction right before the session. I have clients that they have a book that they enjoy. Some people kind of do some gaming on their phone, or maybe you're someone that you can get mildly anxious and you have good coping strategies. And then maybe you can do a few rounds of breathing exercises before the session. And you don't need to be fully relaxed when you go into session. Therapists, they know that the clients are uncomfortable oftentimes during the first session, and as part of our job is to make you comfortable. So don't worry if you feel anxious, it's completely normal. And I want you to know that no matter how rare you think your issue is or how deep you think your issue is, we have seen at least hundreds of similar cases. There's nothing that you can share with your therapist if they're seasoned that they haven't heard before. I heard challenging trauma stories, abuse stories. I heard challenges around acute eating disorder behaviors, issues that people feel a lot of shame around, which I totally understand. And it doesn't make the therapist, or at least me, to think less of them. I experience people very courageous when they're coming to me and talking about their challenges, because it shows that they want something different. So make sure that you are preparing, doing some emotional regulation, coping strategies based on your level of anxiety. Going into a therapy session, it's helpful to identify your goals, like what do you want to experience in your life? What are some of the changes you want to experience in life? And what's been some of the patterns in your life? For example, if your issue is in your relationship, think about commonalities in your previous relationships. Maybe you are in a therapy session because you are struggling with addiction. Think about what are some of the different ways that you tried to stop and you struggled. So these are the good information that you can share with a therapist so they can understand how they can curate a personalized plan based on your strengths and weaknesses. At the end of the session, therapists usually help you to come up and clarify your goals, and they tell you about the treatment plan. What treatment plan is, how are you gonna move forward with taking steps to see results? It's really important to have clarity about how frequently you will see the therapist, what are some of the approaches they use, what can you expect. All of those things can help you to prepare yourself mentally and emotionally. after the session, I recommend people to have some time to relax and take care of themselves. Sometimes when we are talking about difficult emotions, we might get surprised because we might feel anxious, we might feel overwhelmed, and maybe right after a therapy, we're not ready to go to a work call or we're not ready to drive. I recommend you to have at least half an hour buffer times that you can relax, you can do breathing exercises to make sure that you are grounded enough to enter everyday life. Again, I'm super proud of you for booking the first appointment. If you are looking for a therapist, you can find all of my opening in the link below. And if you have any question, put it in the comment. We are happy to help you to set yourself for success for your first appointment.